I'm Coral Olazagasti. I'm a thoracic and head and neck oncologist at the University of Miami, and I'm just excited to talk to you again and finally come back home from ASCO. Like you feel like empowered. I came straight to clinic yesterday, so I was very excited to just share with the patients. Like I just came back from like the biggest conference in oncology in the world. There was over like 45,000 people, and we heard so many studies and so much good data, and just like excited to really see how that transforms and transcribes into the real world patient settings. I think at least my patients, they really love to hear about it, and I think it just gives us like hope that we know that there's like so many good science being discovered, and kind of like everyone's just doing their best to make cancer a more treatable disease, and it's just like pretty exciting times overall. I think in terms of like what studies were presented, so there was obviously like several sessions for thoracic oncology. We saw in the metastatic session that there were studies such as like the Hertina study that were not really as impressive. I think we're still the jury's still out for like ADCs and what that's going to transform into, especially in the first and second line setting. But it's also not always like interesting or important to only see the positive studies, right? I think sometimes there's definitely value in the negative studies and just to see where we are at the moment and what can we learn and how can we incorporate those learning points into designing other further studies and kind of like make perhaps some tweaks. I think the studies that I was most looking forward to mainly were the ones in the early stage or localized disease. And so one that I was really excited about was the CheckMate-816. And so this is a study it's neoadjuvant chemoimmunotherapy with nivolumab in patients with resectable stage 1 to 3A non-small cell lung cancer. Now, we are already aware of this regimen. This regimen is already approved and it's used in the clinic. But what we found that when we saw in this year's ASCO was the overall survival. And that's usually what we really get excited about because we know that even though progression-free survival is a great endpoint, we really want to see if those findings transform into overall survival benefits because this is really what our patients want to know, and also we want to know ourselves. And so this study found that in the patients that were given the combination of chemotherapy with immunotherapy upfront before surgery versus just the ones that were randomized with chemotherapy alone, they had like a 5-year overall survival benefit of 65% versus 55% with chemotherapy alone. And so whenever a PFS benefit translates into an overall survival benefit, then it's really something that we can confirm and we can feel pretty secure that this regimen really actually works. I think one of the most interesting components of this study is that we have other trials and other studies that also look into the neoadjuvant setting with chemoimmunotherapy. For example, the Keynote 671 using pembrolizumab. But the difference in that study is that instead of using 3 cycles at the checkmate, they use 4 cycles. And also in the keynote, they use adjuvant immunotherapy. So basically, they do the sandwich approach with neoadjuvant followed by surgery followed by adjuvant. Versus in the Checkmate 816, they only use 3 cycles, so 1 cycle less, and they don't necessarily and it doesn't incorporate adjuvant immunotherapy. And so this is important because like is it really necessary? Are we over treating with 3 cycles and then maybe perhaps considering whether really adjuvant therapy is needed? These are all great points, and because patients also want to know that, right? We want to make sure that we're giving the best outcomes for my patients without over treating them because more is not always best. Like sometimes really we overtreat it, and so these trials are so important to also understand, well, if we have equal benefits and if really have overall survival responses and benefits, then perhaps this is good enough. And so I think that was one of the studies that I was most excited to see come out. I think the second study that I was really interested to see that I think was definitely practice changing is in the small cell space, which is the IMforte study that was presented by Dr. Luis Paz Ares. And so small cell is a very, very aggressive disease. It's really hard to make changes. The main set of treatment has been developed for the past like 20 years. And so having a breakthrough in this like such aggressive and difficult to treat disease is always so, so inspiring and exciting. So the IMforte trial is a phase 3 study, and they compared the use of atezolizumab with lurbinectedin compared to atezolizumab alone as a maintenance therapy in patients with extensive stage small cell lung cancer after platinum-based therapy. And so the study found that the progression-free survival was 5.4 months in the combination group compared to 2.1 months. And again, we talk about overall survival benefits. The median overall survival in the combination groups is 13.2 months compared to 10.6 months. And so in someone, in a patient with extensive stage small cell disease, almost 3 months difference in overall survival, this is a huge deal because we know again that this disease is so, so aggressive. It's the prognosis is very, very poor. So being able to bring this data to the patient is so exciting. And as a matter of fact, yesterday I was seeing a patient that's currently undergoing the chemotherapy portion of this study. And then I was so excited to be like, listen, this was just a study that was presented after we're done with this 4 cycles of chemo. I'm gonna add this like drug. It's called lurbinectedin, and they show that you're gonna live a longer time, hopefully. And so it's just so important to me, and I feel like so, so excited whenever we can bring good news to the patient. The patient was like lighting up, and it's just like really makes this whole career and this whole really everything that we do meaningful, because ultimately really we want to see data change and we want to see the science progress, but ultimately what we really want to see is our patients live a better life, a better quality of life, and hopefully a longer life. And so those were the two things that I was looking forward to most. This one particularly was a really practice changing study, and I think that was like super interesting to see, because also like in this ASCO, then we had the DeLLphi study which uses a second line tarlatamab, and I feel like that just like perfectly adds like now the sequencing of events. So now we're moving lurbinectedin that used to be used as a second line to the maintenance setting, but we're not leaving that space empty. We're filling it up with tarlatamab. And so it's exciting to see how everything is falling into place. And yeah, those were like really kind of like the highlights of my day.